So we're away. You can't see me. This is Alex Perry from Fertility Acupuncture blog on this side, interviewing now a good friend of mine, Mike Berkley from the Berkley Center in New York City. G'day, Mike.
Hey Alex, it's great to be with you, and it's great to have you here with us. And of course, right in the middle of this interview, my phone rings. I'm sorry about that.
It's all good.
I apologize.
Thanks for agreeing to do this, Mike. You know, the people who follow our blog and listen to this stuff are practitioners, but also patients interested in fertility and acupuncture and how we can help. So I thought I'd just get you to start by maybe telling us a little bit about your practice here in New York City, and yeah.
Sure, I'd be happy to, and thanks for the opportunity to be on your blog. So I've been in practice for about 13 years in New York City. I was the first guy in the States here to devote a practice to treating infertility exclusively. And for those of you back home in Australia, you're about to hear fire engines and police cars. Welcome to New York. I had a patient, back about 13 years ago who was about 42 years old, did a couple of IUIs, a couple of IVFs, couldn't conceive. I had no idea what I was doing. I didn't even know what FSH meant, but I agreed to treat her under the conditions that she understood that I was a complete novice, and I treated her for 3 months. She conceived and had a baby, and I decided at that point that I was going to devote the rest of my life to studying and practicing reproductive medicine, of course, from a traditional Chinese medicine perspective, but I've also devoted a lot of time and energy to learning the Western medical side of things as well.
And so how, I mean, in Australia, where, we, obviously our population is small relative to the United States, but we still have a lot of patients who are using the assisted reproductive technologies, IUI, IVF, and, it's been, in the last few years, it's certainly become more popular, and the IVF clinics are starting to work more closely with Chinese medicine practitioners. How is that here in New York City?
It's kind of in tandem with what you guys are doing in Australia. I mean, more and more reproductive endocrinologists, not only in New York City, but across the United States, are, at least telling their patients that it's not a bad thing to do acupuncture. It goes from that end of the spectrum all the way up to certain clinics actually having acupuncturists working in their clinic. So, in other words, they're embracing it a little bit, or they're embracing it a lot. But I would say, really, there are very few reproductive endocrinologists who are not on board with acupuncture today in the U.S.
That's terrific. No, it's interesting to me. I travel all the way across the other side of the world. We're in New York City, which is, it's a fabulous city. I've always been drawn here, and Chinese medicine is a language. So I can come from Australia, and you're from New York, and we can get together and still talk about Chinese medicine stuff and
especially
understand.
over a good beer.
Over a good beer, absolutely. A question I love to ask practitioners is because there's this concept of qi within Chinese medicine, right? And it's one of those elusive sort of concepts, I suppose. Can you give us your brief outline of what your perspective of qi is?
Yeah. Qi is a word that has no real translation, and people say that qi means energy, and that everything has qi in it, including rocks and even plants, dogs, cats. It's energy. It's the motivating force behind any activity. I think of it a little differently. To me, qi is what the practitioner gives to the patient. When I have a patient on the table, and that patient has had 3 failed IVFs, and she's 40 years old, she's got an FSH of 25, and every time she's coming in, she's crying and crying, and I hold her hand and look at her in the eye, and I tell her it's going to be okay, and she exhales, and I put a needle in her, and she becomes relaxed, that's a transference of my chi into her, which is another way of saying, my positivism, my positive energy. So in a sense, they say acupuncture, alters or manipulates chi, and I believe that, but actually even talking to somebody, even touching somebody physically can help manipulate their chi. So I really think chi is a vehicle upon which energy can be transmitted or transformed and manipulated.
Yeah, I agree with you. It's an interesting concept, and I think one of the things that's attractive to me about Chinese medicine, anyway, is that you can have two people, you can have five people talk about the same concept, and all be have a slightly different variant on the same thing, but still all be right to one degree or another.
Well, there's a joke here in the States that says you put 4 doctors in a room and you'll be sure to get 5 opinions. So it's a similar trend.
Absolutely. Hey, Mike, I noticed you've been really busy this afternoon, which is great. Yeah. I wonder if you're noticing any trends. Are there things happening in New York City, fertility-wise, that are popping up time and time again? I'm thinking about particular syndromes or anything like that.
Alex, I can't say there's a trend really, but I can simply say that every type of pathology walks through this door, including, forgive me for sounding so Chinese, the pathology of no pathology, which means idiopathic infertility. In other words, no known cause. But we see patients that have tubal damage that are going to do IVF. So what's the case at hand? The case at hand is to improve their egg quality. We see patients with polycystic ovarian syndrome. So what's the case at hand? Improve their egg quality or help them to ovulate. We see men with low sperm count that don't have obstruction. So they have low sperm count due to stress. We try to relieve their stress and increase their sperm count. There are men that have sperm DNA fragmentation. We try to reduce the DNA fragmentation percentages. We have endometriosis patients that even though they've had laparoscopic intervention, there may still be infertility, and nobody knows why, but the reason why is because there's still remnants of endometriosis in there that cause inflammation in the uterine cavity, and so we use acupuncture nerves to reduce inflammation. So we're really seeing a broad spectrum of pathology, and we're seeing a broad spectrum of patients, meaning we see patients who are 25 years old, and we see patients who are 45 years old, so it's really all over the board.